Hello, my name is Ezekiel Oburu. I'm an orthopedic surgeon at Nairobi Spine and Orthopedic Center. And today I'd like to talk to you about one of the common injuries that we see as orthopedic surgeons, and that's an ankle fracture. So if you look at our image here, the ankle joint here consists of three main bones. We have the talus, we have the tibia or the leg bone, which goes all the way up, and then we have the fibula, okay, which is the other leg bone. So there are different types of ankle fracture that you may get. One fracture involves just that part of the fibula. We call this the malleolus, and the other one could involve this part. We call it the malleolus. This is a lateral malleolus, and this is a medial malleolus. So what happens when a patient has an ankle fracture? One of the things that happens when a patient has an ankle fracture is they get a lot of pain and they get a lot of swelling, and they find it very difficult to walk. What are the options of treatment with an ankle fracture? We have a number of options. One, initially it's very swollen. So what we do is sometimes we put a cast, but we put a half a cast, also known as a backstab. But if you have got an ankle fracture which is not very badly displaced, like in this instance, we just have what is known as a lateral malleolus, then what you could do is put the patient in a cast, and you can see that this patient has been put in a cast. How long will we put this patient in a cast? Usually for a period of about 6 weeks. After 6 weeks, the patient's fracture has completely healed, and therefore we take the patient off the cast and the patient can start walking. But there are ankle fractures which can be so badly displaced, and these ankle fractures will need fixation, and the fixation that we may have is shown in this patient, who is different from the other one. You can see here, this is the fibula. There was a fracture in the fibula, and what have we done? We've put what is known as a fibula plate. We put a plate on this side too, and we put a screw, and this screw is going all the way from the back to the front. It's important for you to note that when you look at an x-ray, you're looking really at a 3D image, but the x-ray only gives you 2D, and that's why you can think this screw is coming from the front, but really it is coming from the back. How long do you put the patient non-weight bearing? You put the patient non-weight bearing for a period of about up to 4 weeks, and then they can start weight bearing. So there are two ways you can treat ankle fractures. You can treat them non-operatively, or you can treat them operatively. Non-operative is the treatment that we choose if the ankle fracture is stable, and operative is a treatment that we choose when the ankle fracture is unstable, and usually they should give a good result. Thank you very much.